Ready?
Live.
Good. All right, guys, we're on our female sculpting patient number 2 in Manhattan, and we're doing a similar thing, upper face, under eye contouring. Most younger people really start to notice the signs of aging in 2 major places, well, really 3, but 2 that they often come in for. 1 is the under eye, and 2 is the neckline or the jowls. The third place that people notice it but don't talk about it a lot is their eyebrow and their eyes. And here we're just going to put a little bit of filler to the under eye and then long-term work to tighten. We've used a little filler here to lift the mid-face and define her lateral contour. She has a beautiful chin, jawline. Now we balance the Holy Trinity, which is here. And now we're just going to go right into the upper eye area and fill out the trough. Now I like using Vicross technology fillers here. Although if you listen to a lot of practitioners, they say that they have issues with it. I've been using this before it even came out for this. I did the lip clinical trials in a fellowship, and maybe because of my experience, or maybe because we do very micro quantities, sorry honey, we're on the bone, micro quantities of the filler, we get really good results. And what's nice about it is it lasts a long time. So we're using Volbella. Make sure I'm not in a little clock here. And you switch my cannula to a different cannula. I think that was clogged. We are using Juvederm Volbella, and you can see that here. It's a smooth gel. But the reason I like it is it's very soft. There should be one there now.
No, it's in the one.
Okay, we're going to get that one. Yeah. Hold on. So we're using it. We're going to use the cannula as a clogged or something. That's okay. We're going to get a new one. But we're using a cannula here because you can see. Look at her blood vessels. When you put a needle in there, she'll be bruised for like 3 weeks. Come on. Please. How did the cannula feel? It's a little shocking, but it's not that painful.
No,
right?
it's not bad at all.
I got it. Good. Okay. So we're gonna go back in that same spot. Make a little spot. John, will you grab that?
Yep.
Perfect. Good. Go right into there. And again, you see here's with the cannula, we can just kind of snake through the tissue and inject without really any bruising. And that's the key. Especially for her, we want to kind of fill out even the lateral hollows a little bit. So you can see we're right up here. I'm going to show you right here, the lateral edge of the eye. Injecting just a little bit of filler all around because she has hollowing throughout. And we know it's not going to be 100%, but we know it will be improved. All the way up here. Good. So now what we can do is do a light massage into that area. Good. Close for a second. Hold right there lightly with your right hand. That pressure helps to limit any issues. Now we're going to go to the other side and do that same thing, same technique. Already got a nice elevation in the cheek. We're just going to balance that out with under eye. Good. You can see she already oozes just from the needle poke. You might leave that back. Sorry, honey. Sometimes, hold on, there we go, got it. So we're gonna go right on there, we're gonna snake under there. You can see right here, right under the skin. In very small quantities. I'll switch you a second. And we're gonna kind of loop around, treating all the eye. You can see the cannula right there. I'm doing very little micro droplets. This is a technique I developed that helps make it very even. It makes it so there's no lumping and bumping. And then what I want to do for her, with this little extra amount, is come all the way laterally here up into the actual corner of the eye and get some of the filler there too to blend the cheek. Okay, so now we massage lightly. This filler is very smooth. Close your eyes, hold right there. Good. And I'll just show you really quickly. This you don't see as much initially. Oh, someone got it? I'm sorry. Perfect. You don't notice this as much initially because under the eye it takes a little bit of time to build, but let me show you. Hold here. You can see at least the eye and cheek blending.
Oh yeah.
Much nicer.
Much.
So eventually what I want to do is go a little higher and work on the lateral hollowing here and through the brow. So through temple and brow, this area right there. This is a region a lot of people miss, plus they're nervous because there's a lot of blood vessels.
Okay.
We have elevation here. We could eventually do a little more elevation there, and then we'll work to do lasers and or more fillers there. But initially it's better, and it doesn't look like it was done.
Right.
Cool. All right, great job.
Thank you.
So hold just a little bit of pressure, just for safety purposes. Right.